Thank you. We'll move now to the third question, and this time we're going to start with Peter. And this, should accreditors play a more active role in fostering faculty development and program quality improvement in education?
So we've had a standard for some time, in addition to quantitative faculty and qualitative faculty. Do you have enough? Do you have the right people and the right mix? But we have faculty development as a standard that we've had for a long time. That, once they're there, they have to be developed as educators, as researchers, and more importantly, they have to be developed to understand what interprofessional education is and how to do it, because it is not something they were trained in. They have no vision for it. They have, it needs to be part of their faculty development. And we've extended this to the preceptors, and we've actually moved preceptors from underneath the faculty line to a separate standard to say that preceptors, in our case, is 35% of the curriculum is external. So these people have to be, continually upgraded in terms of what the school is doing, but more importantly, what the standards are trying to accomplish, what competencies we're doing, how we're assessing them, and the importance of how to work together with other health professions themselves so that they can model that behavior for the students.
Thank you. Judy?
Thanks, Pam. I would agree with everything that Pete has just said in terms of the faculty development and how to go about that. I'll come at this question a little differently in terms of, should we play a more active role in fostering faculty development and program quality improvement? First of all, I'm not sure most faculty really understand what program quality improvement might actually be. And so, we're clinical experts, we're experts in our discipline, and then we're put into an educational system and suddenly asked to consider accreditation and what that means, and it becomes oh, here they're coming. We want to think about it every so many years, but not on a regular basis. So when you start talking about program evaluation and you start using the words continuous quality improvement, and what does that mean to a faculty and their role? How do we make changes in the educational system to address some of what you were talking about, Pete, when faculty don't necessarily have always an understanding of those concepts? And I do think that is a piece that does need to have some attention. Does accreditation or accreditors have a role in that? Absolutely, but not a sole role, because I think that's something that education and practice as well would have a role in. What do we mean about just quality improvement in general, and how do you look at that in a system perspective? Whereas I think many of us are comfortable about our own contribution to the system, but do we really understand how that contribution affects the entire piece? So I would say definitely yes. We also have a lot of novice educators coming into the world. We have a lot of turnover from retirements. So this development piece is going to be with us in a high, it's a really an acute need, I think, at this point. So I'll stop there.
Thank you. Rick?
I agree with both the comments. In a way, the statement is almost a ray ipsa loquitur. I mean, really, we would say no, that accreditors shouldn't support anything that's going to foster for quality improvement in education. I'm not as sanguine, though, about the word active in the statement. In terms of what does an active role of an accreditor play? And from my perspective, the more that that accreditors focus on the goal rather than the mechanism to get there, which would mean, faculty development can paint with a broad brush. Faculty development includes everything from improving their research capabilities to giving them X amount of dollars to go on travel, to do a whole lot of things, which we would all support. But in terms of what is the real role of the accreditor is, to me, to get to the outcomes. And so to say that indeed somewhere in the language that if in fact you're not developing your faculty and that is interfering with quality improvement and that's interfering with the outcomes, whatever you've defined in that program, then I would say yes. If it's one of accreditors playing a more definitive role with regard to specifying the mechanisms by which this is executed, then I would say no.
I would like to thank you just for teasing that piece out, because I spent a lot of time focused on more active, just what you just kind of said, the active piece and what that meant. And so I do agree there is an element there, a place for it, but the main responsibility probably does exist somewhere else.
Okay, great. Question out there?
Bjorg Palsetter from the Training for Health Equity Network. I think this is it's an interesting and important question because you know, a lot of the discussions we've had around whether it's community engagement or whether it's around communication, there's a lot of skills that you might not necessarily come with or have developed over time, because you know your expertise remains mostly technical. So I think it goes back to what Rick was saying before. If you start with the needs, what are the needs of the patients, and then what do the faculty have to, what kind of competence does faculty have to train or mentor students in obtaining those needs? And I think the mentorship element is also important. Now, exactly the role of accreditation in it, it's that could be tricky, but I do think it's an important topic to look at.
Elizabeth Hoppy from Association of Schools and Colleges of Optometry. I think there's a big difference between having a standard requiring faculty development and an accrediting body serving as a resource with services and support to develop faculty members. In my profession, our professional accrediting body will do workshops about the role of accreditation, workshops about how to do a site visit, how to do a site review. And it's really quite self-serving because they rely on faculty volunteers to actually get the work of accreditation done. I've reached out to my professional accrediting body on specific issues and with a question related to faculty development, and I've received the response, it's not our role to be your consultant. So I think there still remains a gap of what's possible and what would be beneficial to the institutions who are struggling with this with limited resources.
Thank you.
Oh, can I? Oh,
Yeah,
sorry.
well,
Well, I was just going to respond. There's almost total lack of homogeneity across. I mean, I guess as a dean, I've got 13 different accrediting bodies that are there all the time, and then the regionals. You know, 15 years of being in this kind of a role, there's never been a semester go by that there wasn't an accreditor somewhere in the building. You know, but it does, I think, get to the point that several people have made with regard to, I think, more homogeneity across, with regard, for example, without naming the accreditor, one accreditor at the end of the accrediting process will in fact declare the accreditation is over. I'm taking off my accreditor's hat. Now I'm here to help you. And to a certain extent, that's good. Another accreditors group will come in though, and absolutely, if anybody asks them the question, that's not our job, that's your job. And so, you know, if we could come to some rapprochement or whatever to kind of coordinate across the accrediting bodies as to what that role is and define it more homogeneously, I think it would be better. I don't know. So.
thank you. I'm going back there, then I'll come to you.
I'm John McCarty. I'm with the Accreditation Review Commission on Education for PAs. I want to congratulate Rick for identifying what really is a slippery slope, because we could find ourselves as accreditors playing an active role in teaching anatomy, doing budgets, a lot of the other things. I think the active role that accreditors play is reminding through standards and holding institutions responsible for developing faculty. I think professional organizations and professional organizations of educators are equally responsible for helping those within that profession and within the education profession to develop faculty. And there's a variety of ways of developing faculty that uh, is necessary. And finally, what is I think being recognized more frequently now is that, at least in a lot of the health professions, there was the didactic and then there was the clinical. And you taught everybody something in the didactic and you sent them out and you said, well, I hope something good happens. And that was the clinical side. And there's certainly, I think the accreditors have done a much better job in demanding that there's a continuum of that education that ends up in the clinical arena and should actually be occurring in both sides of the aisle, not just the didactic side where you can put 500 students in a classroom and then hope 500 students can find a place to practice clinically with under the guidance. And I again, Rick, that's a slippery slope, and thanks for picking out that one word, which active means something entirely different, and I don't think you want accreditors doing. And oh, by the way, you're right. We say that that's somebody else's responsibility. I'll admit to that.
Thank you. I'll go back over here. Jennifer.
Jennifer Butland with the Commission on Collegiate Nursing Education. I'm really glad that somebody offered the comment, whose responsibility is it? And, what is the accreditor's role versus the institution or program's role? And I agree completely that the accreditor's job would be to have perhaps a non-prescriptive standard or criteria in place stating that faculty development is an expectation, but allowing the program to define the roles of faculty, how they're related to scholarship, teaching, practice, and service, looking at the outcomes and faculty achievements, but that the details and the way faculty are developed is the prerogative of the institution and the educational program. And what we do at CCNE, and I know that many of my colleagues in accreditation approach this the same way, we offer lots of workshops, webinars, forums on writing self-studies, Accreditation 101, how to apply the interpretation of the standards. But when it comes to consultation, advisement, discussing best practices, we leave that to our parent organization, the American Association of Colleges of Nursing, which offers dozens and dozens of workshops and interest forums every year to faculty who are interested in particular topics. And it might relate to teaching, learning practices. It might relate to clinical experiences and evaluation and selection of preceptors. It runs the full gamut in terms of content and faculty development topics, but we believe that it's not the role of accreditors to offer that type of programming, and I know a lot of my accrediting colleagues agree, because those survey results that I shared with you yesterday showed that those notable collaborations or MOUs or agreements that accreditors have in place are in fact with membership associations, including their parent organizations, and offering programming to help develop faculty is certainly one example of that.
Thank you. I heard the gong, but I want to make one more comment before we go. So I want to talk about the National Council of State Board of Nursing simulation study. It was a landmark study done on if we could substitute real clinical time with simulations up to 25%, 50%. And it was a phenomenal study, 10 schools. Anyway, the evidence is there that simulations could be substituted. Anyway, there was qualifiers that faculty needed to be developed. There was a theoretical basis for debriefing, et cetera, et cetera. So in October 2015, just about 6 months ago, they came out with guidelines through their Journal of Nursing Regulation. I like it because faculty development was in there. And if schools are going to, approach substituting real clinical time with 50% or 25%, and many have to because of the clinical needs in rural areas, they can't find the clinical sites, they're competitive, et cetera. But they were guidelines that the National Council put out, and it was directed toward faculty development. How are you going to provide that your faculty are development in using this pedagogy? because the debriefing is an art in itself. It's a type of pedagogy that everybody's not there. Also, there were guidelines about the equipment and just kind of the environment itself. Before everybody started jumping on the bandwagon to go 50% as substituting, there were some qualifiers. Anyway, I just give you that as an example from our profession.